In most cases, when a woman misses her periods, we think she is pregnant, and this is good news. However, there are women who miss their periods when they are not pregnant. Missing periods is what we call amenorrhea, and there are several women who have failed to get pregnant just because they are not seeing periods. They get devastated because of no periods. 1 year, 2 years, they are not seeing periods. We would like to know what causes this and how we can treat it.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me, to have a private chat, go to my website www.drothman.com and book an appointment. We shall be in touch, we shall talk and find probably a solution for you. Also, if it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important update we give. Now today we are talking about something very serious. By the way, today I'm very serious, and it is concerning amenorrhea, because they are women who are devastated out there. They are not seeing their periods and they are wondering why. This is the time you should be very attentive to identify, to find out, to get the reason as to why you are not menstruating and what you can do in order to do so. So amenorrhea. Amenorrhea is termed as failure to have your menstruation, to see your periods. In some instances, it's normal, but most instances, it's abnormal. For example, this can be normal during when a girl has not yet reached puberty. A girl is still young, 8 years, 9 years, she has not yet reached puberty. It's normal for that girl not to menstruate. Also, when a woman has reached her menopause, 40 years, 45, and so on, it's also normal for a woman not to go into her periods. Another incident where it's normal is during pregnancy. Of course, we don't expect you to undergo menstruation during pregnancy. Then also, for most women actually, when they are breastfeeding, especially those women that are breastfeeding regularly and doing what we call exclusive breastfeeding, most of them will not see their periods. However, there are those that are not in that category and are not seeing their periods. What causes that? Now, we need to understand the human or the female reproductive structure. Please join me here. Now, when you look at this female reproductive system, this is a clear female reproductive system. We are seeing the ovaries, we are seeing the tubes, we are seeing the uterus or the womb, then we are seeing the cervix, and then the V. There is a system, there is a systematic interplay. There are a lot of activities that occur for someone to have menstruation. I want you to understand how someone goes into menstruation. What happens is that there is a signal. There is a signal sent by the brain. So in this case, it is the brain that is going to control the menstrual cycle in one way or the other. How? This brain is going to use what we call the hypothalamus. Hypothalamus is the one that controls the pituitary gland. I don't know if that is too much science, but we have a part of the brain called the pituitary gland. And it is this pituitary gland that sends signals for production of a hormone called follicle stimulating hormone. What does follicle stimulating hormone do? I've several times discussed about hormones, but what does FSH do? Follicle stimulating hormone. What does it do? This hormone is sent to the ovary. And once it reaches the ovary, it prepares the ovary to manufacture and grow eggs. It is responsible for proliferation, for growth and maturation of the eggs. Therefore, the brain, through the hypothalamus, will order the pituitary, for the pituitary to tell the ovary to produce and grow and make mature eggs or the ova. It is again this same brain, after ordering the hypothalamus to order the pituitary gland to cause the secretion of the luteinizing hormone. Now this is where the whole story begins. So the brain has told the ovary to produce eggs. Now when the egg matures, again the brain is going to send another hormone called luteinizing hormone to tell this egg to move. Now because of the luteinizing hormone, this egg is going to move and cause what we call ovulation. So this egg is here, it is going to move from the ovary into the fallopian tube to cause ovulation. And at that time, this egg is waiting for the sperm, for the male sperm, for them to fertilize and then form a zygote, which will come, implant in the uterus, and then someone gets pregnant. Now what is going to happen is that when there is ovulation, then this ovary also has hormones that are under its command. And the hormones that are under its command are, number one, progesterone and estrogen. So these hormones are also going to be secreted by the ovary. When they are secreted, these hormones are going to prepare the uterus. I don't know if you guys are understanding this. The brain has ordered the production of follicle-stimulating hormone to prepare to mature an egg. And then the egg is also moved into the fallopian tube. Now, the ovary, the sac that contains the ovule or the eggs, is also going to lead to the manufacture, or it will stimulate the manufacture of estrogen and progesterone. Now, the hormone estrogen is responsible for preparing the uterus, the underlining of the uterus, the womb, to receive the zygote. Because with this process, when a zygote is formed, it is going to come and implant itself here in the uterus. So what the ovary is saying, it is going to make a phone call to the womb, to the underlining of the uterus, telling it, please prepare, put some shelter, put a house, put a tent for my child. So the womb is prepared, it is ready to meet, or it is ready to shelter the baby. I think it's clear there. Now, because the womb is ready to meet the baby, how is it going to be ready? It is going to construct something like a tent. It is going to construct something like a tent on the underlining of the uterus. So once that tent is secreted, is formed, it is ready to receive the zygote. However, if there is no fertilization, for example, the sperm has not met the egg, this egg which is here will only spend at least 24 hours to 48 hours, and then it will disappear within the body. It will be dissolved within the blood circulation. So, remember, the uterus is waiting. It was ordered by the ovary through the hormones, the progesterone and estrogen, to prepare for the baby. It is going to wait. When 14 days pass, 14 days after the ovulation, when 14 days pass and there is no baby coming, it will ask itself, what is happening? This ovary told me they are bringing the baby, but the baby is not coming. It will feel angry and it will shed off. It will shed off the what it had built. It is going to dismantle the tent, because the tent was supposed to keep the baby, but now the baby is no longer there. There is no baby coming. Therefore, this endometrium is going to be shed off. When it is shed off, it comes out in form of blood. And that is how a woman undergoes her menstruation. Now, when someone has not seen her periods, or when someone fails to see her periods, it means there is a problem at any of these stages. It can be in the brain, it can be in the ovary, it can be in the uterus, or it can even be here in the cervix, because the cervix is also playing another role. How? When blood is shed off, the cervix will open to allow blood to pass through. So if there is a problem around any of those areas, then we are going to have issues with periods. Now, this, what we call amenorrhea, is divided into two. There is the primary amenorrhea and then the secondary amenorrhea. By primary amenorrhea, we mean a girl who has never had her periods, but she has reached the age of having periods and she's not getting her periods. When it reaches 15 years, 16 years, then we start talking about primary amenorrhea. And again, for secondary amenorrhea, we are talking about a lady who has ever had periods. At 12 years, she received her periods, 20, but now she reaches 25, she's no longer seeing her periods. That is what we call secondary amenorrhea. So, the causes of primary amenorrhea and secondary amenorrhea, some of them are the same, but most of them are different. Let's first look at the primary. Those for a girl who has never seen her periods and she's at 15 years, no periods again. Let us look at that. Number one, the problem may be genetic. You may have chromosomal abnormalities. So for especially chromosomal abnormalities of the ovary, you may find that the girl doesn't have ovaries. So if you don't have the ovaries, we shall not have production of estrogen, the signals and so on. Therefore, the girl may not have periods. And then we have problems with the brain. The brain can have issues, especially on the hypothalamus and then the pituitary gland. We have already seen the roles of the brain, the roles of the hypothalamus and the pituitary gland in this. And that is follicle-stimulating hormone and then the luteinizing hormone. Now, if we have tumors or we have diseases affecting the pituitary gland, we are going to have issues with menstruation. Now, just imagine that you have a tumor. At the end of the day, this girl is going to be having high levels of prolactin, and then when prolactin is high, menstruation will be affected. Now, another problem can be structure. Especially when a lady or a girl is missing some parts. May be missing the ovary, may be missing any of the reproductive parts. But the main issue we can talk about, which is the commonest, is the imperforate hymen or the imperforate cervix. So, the process can take place. There is blood, there is shedding off of the endometrial lining, then blood impacts itself into the uterus. Now it wants to pass through, but where will it pass? When the hymen is closed, when the cervix is closed. So imperforate cervix or imperforate hymen can also cause primary amenorrhea. Now, we can also have issues that cause amenorrhea in a secondary way. By secondary, we mean a lady has ever had menstruation. Started at around 12 years, menstruating at 12 years. Then by 20 years or 30 years, all of a sudden, menstruation stops. 1 year, 2 years, she's no longer bleeding. These can be the causes. Number one and the major is hormonal imbalance. I'll talk about this monster. I don't know how it can even be eradicated. Hormonal imbalance. Because we've seen that the whole of the menstruation activities are controlled by hormones. Mainly follicle-stimulating, luteinizing hormone, estrogen, and progesterone. Then also in the side mirrors is the prolactin. But we shall not talk about it so much here. So now, if hormones are inadequate, especially these hormones, or the progesterone is low. If it's low, and actually most women with amenorrhea, with secondary amenorrhea, have low levels of progesterone, then you'll have amenorrhea. Now, if you have amenorrhea, 2 months, 3 months, you are not pregnant, you are not breastfeeding, you've not yet reached menopause, check the levels of your hormones, especially that progesterone. It may be that you have low levels and you cannot menstruate. Then another issue is the primary ovarian insufficiency. Primary ovarian insufficiency. What is primary ovarian insufficiency? This is the condition whereby a woman reaches menopause before menopause. A woman stops menstruation before 40 years. And that is a very big issue with the ovary. There is primary ovarian insufficiency. And now that is one of the major causes of secondary amenorrhea. We can have pituitary disorders. Again, we saw the role of the pituitary gland in this process. So if we have pituitary disorders, because the pituitary is the one responsible for FSH and LH. So LH is not going to be secreted. FSH is not going to be secreted. Or they will be secreted in excessive amounts that will cause a negative feedback in progesterone and estrogen secretion. And therefore, a woman will not be able to undergo menstruation. Another issue is polycystic ovarian syndrome. I have talked about polycystic ovarian syndrome several times. A woman with polycystic ovarian syndrome may have problems, first of all, with ovulation, but again may also not menstruate. Then another issue is ovarian tumors. Ovarian tumors. Someone has a tumor, has a mass. By a tumor, I mean swelling. You have a mass or a swelling on the ovary, you will have issues with menstruation. Now, when we go back to hormonal imbalance, we can look at an issue like family planning, contraceptions. There are some ladies that are on hormonal contraceptive methods or hormonal contraceptive pills. That is hormonal contraceptive pills, that is the implant, and also some IUDs that are hormonal. Injections, the Depo-Proviras of this world. Those hormonal contraceptive pills or hormonal family planning methods can cause hormonal imbalance, and once there is hormonal imbalance, you are likely to have this monster amenorrhea, especially those methods that lower the levels of progesterone. When they lower the levels of progesterone, my friend, it will be very hard for you to have menstruation. There are some ladies who are on chemotherapy. Chemotherapy, I mean the drugs that are used to treat cancers. Those drugs that are used to treat cancers can cause amenorrhea. Also, the radiation therapy, it is also a method of treating cancer. It can also cause amenorrhea. Now, there is another monster of previous uterine surgery. By previous uterine surgery, I mean maybe a lady had an issue in the uterus and then they did the surgery, so there was injury to the uterus. That lady may have issues with menstruation. And the commonest here is dilatation and curettage. You know, when a woman gets a miscarriage, there are at times there remains, there are products of conception that remain. So you've had a miscarriage, but some things are still in the uterus. And now you go to the doctor, they do D and C, dilatation and curettage. That dilatation and curettage, you know, the word curettage means like you're scratching, we are trying to scratch on the uterus to remove anything that is attached on the uterus. That can cause amenorrhea. Then other issues are stress. I am telling you, people underestimate the power of stress. That is why when someone comes to me and tells me that they are stressed, I give them time, because stress can lead to a lot of issues. And here, it can lead to amenorrhea. Someone can miss periods for even 6 months or a year because he's undergoing stress, he's undergoing depressive actions. Now, there is also an issue of poor nutrition. The diet can also cause that. Then ongoing illnesses and chronic illnesses. Those ongoing illnesses and chronic illnesses can cause amenorrhea. Someone is bedridden, they are suffering. You know, those chronic illnesses can lead to failure to menstruate. Now, menopause. Menopause. For women, you should understand that when you reach the age of 40 years and you see that you're not having menstruation, that is not abnormal. You've reached menopause, and if you still want to produce or you still want to give birth, then there are some other methods we can pass through. There are some other measures we can pass through to induce menstruation, to regain your menstruation back, and then probably you can have a child. But that is not abnormal. Now, how are we going to treat this in case it has happened? Because how are we going to treat it? Again, for those of you that have been watching my videos, I always emphasize testing. I emphasize investigations. First test, identify the cause, and then treat. So how are we going to treat some of these causes? Let's look at them. But if it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be updated of any video we upload. And also, if you'd like to get in touch with me, to have a private chat, a private conversation, please go to our website, www.druthman.com, log in and book an appointment. I'll be there to chat with you. And if this video, if this topic we are talking about is affecting one of your friends, please make sure that you share that video so that that friend can be helped. So how we are going to treat this is that We are going to do investigations. We are going to do tests. Number one, I have always said it. Go to the hospital, go to the laboratory and do a fertility hormonal assay. By a fertility hormonal assay, that is a study of your hormones. We shall be able to see that you have enough follicle stimulating hormone, you have enough luteinizing hormone, you have enough of this, and that can rule out the issue of hormonal imbalance. Do ultrasound scans, do x-rays, do as many tests as possible to identify the cause before you start the treatment. I have seen several women, they come and tell me, you know, I spent 3 years without menstruating. I went to the doctor, gave me some tablets. Please, that is not the solution. Getting tablets when you are not aware of the main cause of that amenorrhea will not help, you will not achieve what you want. So, if you do a fertility hormonal assay and the problem is estrogen is low, they will give you medicines for estrogen. Progesterone is low, there are medicines for progesterone. Whatever the case may be, treatment can be found. If it's a tumor, surgery can be done so that you can regain your menstruation. Another thing is stress management. Try to manage your stress. Try to talk to your counselors. Go there, clinical psychologists. Talk to them about what is happening. Then they can help you. You get rid of your stress, and then periods will reoccur. Now, there are those friends of mine, especially the elderly women, that have entered menopause, and menopause is disturbing them. They are having a lot of symptoms, a lot of signs and symptoms that are disturbing them. You can still have some medicines to relieve those signs. For example, you can get estrogen supplements. You can get estrogen injections, estrogen medicines. When you swallow those estrogen medicines, they can relieve you of the hot flashes, you know them, of the hot flashes, of the V or vaginal dryness, and so on. Then you can also take calcium and vitamin D supplements. These ones will enable you strengthen your bones, because most women, when they enter menopause, they lose the bone strength. They get osteoporosis and so on. So when you take calcium and vitamin D supplements, you can be able to restore your health. Even if you're in your menopause, you will not have those funny signs and so on. Because a woman at 40 years is still enjoying, still wants to enjoy the sex life. But now when you get vaginal dryness, of course, issues will turn the other way around. Thank you very much for watching Ask Dr. Uthman YouTube channel. And you can find us on all our social media platforms. The name is Ask Dr. Uthman. If you'd like to get in touch with me, have a private chat, go to my website, www.druthman.com, and have an appointment with me. And again, if it's your very first time, please don't forget to subscribe and also share.
Ask Dr. Uthman on Sawa Wall.